Hi, this is Kaylee Zapata and I'm doing my video assessment submission video one. The first thing I'm going to do with my patient today is we're going to discuss the visual acuity. So two options that you have for visual acuity is one, the Snellen chart, and two, the Romberg assessment. Rosenbaum, sorry. So Rosenbaum assessment. And both of those test visual acuity in your eyes. The Snellen chart is from a distance, so farsighted, and then the Romberg test is nearsighted and it's used for numbers. So the next thing I'm going to assess is my patient's peripheral vision. So please cover your left eye. And do you see anything out to the side?
Yes.
What do you see?
Your finger wailing.
Okay, good. And the other side? Perfect. And do you see anything on this side?
Yes.
Anything?
Yes.
Okay, great. So his peripheral vision is intact. The next thing I'm going to be doing is assessing the muscle movement in the eye. So I'm going to be checking cranial nerve 3, 4, and 6. And I'm also going to be reviewing those to make sure that they're intact. So the first thing that you want to do, a good assessment tool for that, is the H assessment. So you turn a little bit. Thanks. So I'm going to draw two H's in the air, and if the patient reports any double vision, that's a sign of damage to the cranial nerve. I want you to follow my finger with just your eyes, okay? Any double vision?
No.
All right, perfect, thank you. So the next thing I'm going to test is the 6 gaze. So I want you to look up to the left upper hand corner, right? And now to the right upper hand corner, and the right lower hand corner, and the left lower hand corner, left lateral side, and right lateral side. Any visual problems at all? You have any dizziness, anything like that?
No.
Okay. The 6-field gaze was intact. The patient didn't report any pain with that. The next thing I'm going to do is check the corneal reflex. And the corneal reflex is checked just to make sure that the cornea accommodates to light, and that is intact. The next thing I'm going to do is the cover and uncover test, where the patient covers one eye, uncovers. If they have any visual deficits on one side, that will be taken into account. The next thing I'm going to do is inspect and palpate the eyes themselves. So I'm going to inspect and palpate the eyebrows, the lacrimal duct, and the lacrimal sac, inspect the conjunctiva, inspect the sclera, inspect the cornea for the size, shape, color, and symmetry. And I don't see any visual changes there at all. I don't see any deficits. Also going to assess the lacrimal sac as well for any pain or tenderness in that area. The next thing I'm going to check is the lens. And for the lens, I'm going to assess clarity, see if there's any redness, assess the optic disc to make sure that the shape is equal and that there's symmetry on both sides. And that's it for the eyes. I'm going to scan the room since I'm halfway through. Are we good? Mm-hmm. All right. So I'm sorry. I was trying to get my thing set up. Is it camera still? Okay. All right. So the next thing I want to do is inspect the ear. And I'm going to inspect the auricle to make sure that there's no issues with that. And this time you would use an otoscope and inspect the tympanic membrane and inspect the ear canal and lower lobes. And I'm going to do that bilaterally. The next thing is I don't know, that's all I know about the ear. The next thing I'm going to do is a whisper test. So I'll have you cover one of your ears, okay? And just, press it in on your tragus. No, the other ear.
The other ear.
Yeah, just like that.
Yes. Yes.
And do the other thing on the other side.
Yes.
Okay, so that is the whisper test is passed. Next thing I'm going to be doing is checking the Weber and the tuning fork test, which I don't have a tuning fork, so I'm not going to be doing that test. The next thing I'm going to do is inspect and palpate the nose and its size, symmetry, for any inflammation at all. We're going to test the patency of each nair. Cover one of your nostrils. Can you breathe? Okay, so let's say we're going to see if he can smell this sanitizer.
Yeah.
And cover, switch the other side.
My nose is a little stuffed up.
But you can still smell it?
Yeah, a little bit.
Alright, good. So, with the nairs, the next thing I'm going to inspect and palpate, see if there's any drainage, see if their sinuses are inflamed at all with that. The next thing I'm going to do is the mouth. I'm going to inspect and look in the mouth, look at the palate, look at the frenulum, the lacrimal ducts, look at the uvula to make sure that it's aligned. Can you open your mouth and say ah? And I'm also going to inspect the tongue to make sure that that is soft and there's no rough edges. And I was also going to inspect the palate to make sure that that's fine as well. The next thing I'm going to do is inspect the neck and feel on the muscles. Can you shrug against those? Okay, good. And then I want you to turn your head to the right. Good. Any pain at all?
No.
And the left? Any pain at all?
No.
Okay, perfect. The next thing, I'm going to listen to the carotid arteries. Inspect and palpate and listen. So, okay. All right, and then I'm going to listen. Okay. And I'm also going to inspect and palpate the thyroid gland and listen for a bruit there as well. Any pain at all when I did that?
No.
Okay. All right, so that's it for my assessment. I know I probably missed things, but I did the best. Okay, thank you.